lot of my work is dealing with the aspect of behavior and how behavior is a really important thing to understand if we want to make better decisions at a society scale. This is definitely true in infectious diseases, but also more broadly when you think about social systems, transportation systems, any sort of decision-making system over the entire population. The problem that we're trying to address is that behaviors are often hard to observe. Especially as they're happening on the ground. For example, during the pandemic, we didn't quite know how people were changing their mobility patterns on the ground in terms of who was coming into contact with whom, who was doing more social distancing, who was doing less, who was wearing a mask, who was getting vaccinated, what people's concerns were if they weren't getting vaccinated, all of these questions. So there's a lot of unknowns around behavior, and so my work basically tries to address this problem. First of all, can we estimate behaviors better at a finer granularity and in more real time? And then the second thing is, can we integrate these behaviors into decision-making models in public health so that we can guide more tailored, more effective decision-making? In terms of estimating these behaviors, I usually take two approaches. One of them is trying to infer these behaviors from novel data sources. So that includes, for example, aggregated location data from cell phones, or anonymized search logs from, for example, web search logs on Google or Bing or so on. The second approach is a little more new. It's trying to simulate these behaviors with generative AI models.